Followed by that, we will have a panel discussion on the role of implementation science in pediatric and adolescent HIV, which will be led by Anjuli Wagner, who is at the Department of Global Health at the University of Washington, where she currently works as a postdoctoral fellow on projects in Kenya. And she will be joined by Shafika Saji, who's a pediatrician currently at UNICEF as a senior advisor for HIV, and who previously worked as the PMTCT and maternal child health lead of the HIV department at the World Health Organization. So we're very happy that all of these esteemed presenters can join us today. And at the end of these presentations, we will open it up for questions and answers. And we hope to really hear from the audience on all of the work you will be doing and on some of the research priorities where you work. So before we get into the welcome and setting the stage for the webinar, I'd like to just review some basic guidelines for how it will be run. First, if you have any trouble hearing or logging in, please just feel free to message me and I'll do my best to support you. However, some tips include if you have some problems hearing, log in and out of the call as a first measure. If that doesn't work, you can also try restarting your computer. And the use of headphones always improves the audio quality. Second, we ask that you keep your mics on mute, especially while others are speaking, because there can be background noise that can interfere. And to do this, just right-click on your mic icon next to your name. Also, for the Q&A session, feel free to type in your questions, and we will read them out loud for the purposes of the recording. And generally, we record the webinars and share the presentations following the webinar. We'll send out a link so that you can refer back to them and share with your colleagues. So without further ado, I'll hand it over to Martina and Marissa, who will set the stage for the webinar and provide a little bit more of an overview and introduction to what we'll be discussing today.
Thank you very much, Jessica. Good afternoon and good morning, everyone, and welcome to this webinar today. Before I start, I'd really like to thank UNICEF and the UNICEF Collaborative Platform for giving us the opportunity to reach so many of you through the platform, and really happy to really collaborate on this webinar today. So as many of you might know, defining research priorities, it's really one of the core mission of WHO, and it's been there for a long time. And we really feel that it's extremely important for us to identify what are the key priorities that research efforts should focus on, with the goal of maximize impact on policy development and therefore on programs and country progress. With that in mind, we were very keen to really start this process that hasn't been conducted before, and really decided to partner in this effort with the IAS and in particular the CIPHER program, building on the existing collaboration that we have with them, but also with the enormous amount of work that CIPHER has done over the past few years in promoting and accelerating research efforts in the area of pediatric and adolescent HIV. In this effort that we've planned together, we have really done our best to make sure that, in contrast with previous exercises, this process could be as broad and as comprehensive as possible, because we believe firmly that research priorities needs to be developed in a joint manner with the contribution of all the different constituencies, in particular with those of you that are working directly in countries that are accessing services and are delivering the services. And so we felt that having a broad reach was really one of the key priorities for our process. And so we hope that as Marissa take you through some of the detail of that and the results, you will feel that even if you haven't contributed directly, you feel represented in this effort. We particularly keen to have this webinar today because First of all, we'd like really to make sure that the results of these processes that many of you have contributed to are disseminated appropriately to different stakeholders. But most importantly, because we feel that a lot of what's being prioritized, it's really something you can contribute to, and particularly those of you that are working in countries, are delivering services, are engaged and involved in research, have really an important perspective to share with this group. And so the intent of this webinar was very much to share with you the results, but also to get feedback and to hear your suggestions with regards to how we international stakeholders can help you to implement the research priorities in the context of where you work and where your organization works. So as Jessica said earlier, we're really hoping there will be an interactive conversation later on whereby everyone will have an opportunity to share thoughts and suggestions, and very keen really to take good notes and make sure that we act and follow up accordingly. So I'll stop there and I'll let Marisa add and start with the presentation if as needed. Thank you.
Thank you, Martina, and thank you again also to Jessica and to the UNICEF Collaborative Platform for giving us this opportunity to present the global research agendas for pediatric and adolescent HIV to you today. So I'm very happy to present this to you. These two agendas were launched at IAS 2017 in Paris, and I wanted to start out by giving you the links to them. They're currently online and available in English and in French through these two policy briefs. So if you want to follow along a bit through the presentation, they're there and accessible. So in the presentation, I'll be walking through the rationale of why we started this process, which Martina's already talked about a little bit, the objective at the outset of it, the methods that we followed, key steps through the process that we took, and then finally going through the results and the research themes that were identified. So I think that everyone on the line is really aware that there are challenges remaining to scale up timely HIV testing, treatment, and quality care for children and adolescents globally. And to reach the ambitious targets that we have by 2030, evidence is needed so that we have policies that can guide us in not just what to do, but also knowing how to do it. And in this context, there really is a need for further research. And to do that, it's imperative to expand and broaden the stakeholder participation in generating that evidence, but also to define comprehensive goals for future research and what we need to know, and really look at where we're going to have the highest impact with our efforts, while building on established networks and platforms for collaborations that are already existing. So the objective of this process was really to develop a prioritized global research agenda for children and adolescents living with HIV in the areas of testing, treatment, and service delivery. And we wanted to be sure, as Martina, that all the stakeholders were included all the way through the process. So really bringing in everybody who's part of this effort and who is generating evidence as well: funders, researchers, programmers, policymakers, community partners. Just doing my next slide here. Okay, so the method that we used was the CHINRI method, and this was developed by the Child Health and Nutrition Research Initiative. And this is an established method for setting research priorities in health research that has been used several times in maternal and child health. And it consists of three main steps: sending out a first survey to collect research questions, then consolidating those questions into a list that is sent out through a second survey for scoring by the respondents of the first survey. And for the purposes of this exercise, we added an additional step to the CHINRI method. That was an expert consultation to really put into context the results in the context of ongoing research, published scientific literature, and current WHO guidance. Now, this is a one-year process that was carried out in parallel, but separately for both pediatrics and adolescents. And the first phase was putting together an expert working group. The expert working group included researchers, different stakeholders, program managers, clinicians, implementers, community partners, advocates, and young people. And the first step was to define the scope of the exercise in consultation with this working group. And here it was really clear that we wanted to look at testing, treatment, and service delivery. HEU was to be included, HIV-exposed uninfected children. For pediatrics, prevention was excluded in recognition of current and ongoing efforts in that area. And the time frame for implementation of the research to be carried out was aligned with the current global targets that we have, so 2030. And it was clear from the start that we really wanted to have inclusion of different kinds of research, so clinical as well as implementation research. And this is a cartoon that I think really nicely describes the first step of the CHINRI process. It says, I think it's time I put my priorities in order. I want you to find out what they are. And this is what we do in the first step of CHINRI. We reach out with a first survey, calling for research questions to all key stakeholders. And this was sent out through our different listings and networks, and we encouraged snowballing in order to be able to reach the widest amount of respondents possible. And survey one had really a good response with 106 respondents for adolescent HIV and 52 respondents for pediatric HIV and 217 respondents for both populations. And again, just a reminder that the process was carried out in parallel, but separately for both populations. But there is, of course, some overlap in expertise, and people were allowed to respond to both surveys if they felt they could. So the next step was to take the questions that we had received and clean them, removing those that weren't necessarily relevant or within the scope of the exercise. And at this point, we had a total of 986 questions for adolescents and 749 questions for pediatrics. We then undertook further cleaning and organized the questions into 3 areas of testing, treatment, care, and support. But the critical step was really the quantitative content analysis, looking at the themes and sub-themes that allowed us to merge and consolidate some of the questions that we then agreed upon with our working group. These questions, 61 for adolescents and 52 for pediatrics, were then sent out in a second survey to all of the respondents of survey 1 to be prioritized. I just want to make sure that I should continue because it looks like some people are having a problem seeing the presentation.
No, yes, you can continue. The majority of people can see it. It's just one individual. Mm-hmm.
Okay, great, thanks. Okay, so the next step was looking at prioritization of the research questions, and this is a summary of the responses that we had to survey 2. There were 181 respondents overall, and here you can see the number of respondents per population and per research area. And it's important to look at these numbers a little bit because CHINRI concludes that the human collective opinion tends to saturate at about 50 experts. And you can see here that we really exceeded that in each research area, testing, treatment, and service delivery. So that was a good sign of the quality of the process. Overall, the majority of respondents were researchers, and data not presented here confirm that the majority of respondents were from sub-Saharan Africa. Criteria for scoring were defined in the STEP in accordance with the CHINRI approach. It included answerability, impact, implementation, and equity of the proposed research questions. And then these were used with a predefined calculation approach that led to an overall score that could be ranked. And I just want to highlight here that all of the CHINRI ranked questions are available on the CIPHER website. And I encourage you to access them as they give a more granular view of the questions that were submitted. So, putting this all into context, in order to be sure that this was going to have the most impact and that the agendas would be as useful as possible, as I mentioned before, we added an additional step to the CHINRI method that reviewed the agendas within the context of existing WHO recommendations and evidence from systematic reviews, upcoming ongoing research, and recently published literature. And we did this in collaboration with our working group and additional invited experts through 2 webinars. The result of this was top 5 themes per area, testing, treatment, and service delivery, for each population. And as I go into these, the top 5 themes for testing, treatment, and service delivery, I want you to think about the following things. Think about, first of all, it's interesting to see how they're very heavily focused on implementation science, showing us that we really need to know more about the how to do these things. And think about also in your roles, what do these mean to you, and maybe where you're already addressing them, and how you can help to address them. And we have a couple of questions for the discussion later on, which I can share now and we'll bring back, I think, through the webinar after the panel, is to think about if there's anything you want to share later in the discussion about these and the work that you're doing, and what are specific challenges you're facing in your roles with respect to these, and potentially also how can the global community come together to help and support in addressing some of the challenges in addressing the research gaps. But with that said, I will go now into the top 5 themes for HIV testing for children. So for children, the top themes were optimal placement and timing of novel diagnostic tools for point of care use, interventions to ensure timely linkage between diagnosis, treatment, and care, and interventions or strategies to improve access and uptake of HIV testing, and particularly for community-based approaches. And this was a theme that came out strongly through the exercise. Also, factors that enable or hinder linkage to care, and effective, feasible, and acceptable testing strategy at entry points other than PMT-CT for identifying undiagnosed HIV-positive infants and children in different epidemic settings. For adolescents, the top themes were strategies and interventions to improve access and uptake and linkage of adolescents to care, and these were also really emphasized for key populations. Additionally, consent policies and practices to facilitate access and uptake services in adolescents, as well as the safety, acceptability, and feasibility of the self-testing in adolescents were identified as top themes. Moving on to HIV treatment in children, optimal dosing of existing and new antiretroviral drugs and formulations, as well as safety, efficacy, acceptability, and pharmacokinetics of those, particularly with novel drug delivery systems, was identified. strategies and interventions to improve adherence, optimal prevention and clinical management of co-infections, particularly tuberculosis, impact of HIV infection on short and long-term outcomes, and short and long-term virologic and immunologic outcomes of starting very early treatment in infants living with HIV. And obviously this includes the research on functional cure. For adolescents, the top themes in treatment were effective monitoring approaches and strategies to improve adherence, and the safety, efficacy, and acceptability of novel drug delivery systems in this population. Prevention and clinical management of co-infections, again, particularly tuberculosis, as well as optimal sequencing of ART in adolescents. And the impact of HIV infection on short and long-term outcomes, again, and in particular in non-communicable diseases, as with children. Moving on to service delivery, the top themes were strategies or interventions to improve access, uptake, and retention in care, service delivery models to improve both individual and programmatic outcomes along the cascade, including integration into maternal child health platforms, psychosocial and family support strategies to help improve both individual and programmatic outcomes, as well as strategies and interventions to improve and support parents, caregivers, and healthcare providers with disclosure for children. And finally, strategies and interventions to reduce stigma and discrimination experience for children and their caregivers. For adolescents, the top themes were interventions to improve retention and care, strategies or interventions to improve sexual or reproductive health outcomes, as well as strategies or interventions to support pregnant adolescents living with HIV. Also, service delivery models to improve outcomes along the cascade, including peer interventions and differentiated service delivery models. And finally, psychosocial support strategies, again, to improve individual and programmatic outcomes. So as we look at implementing these agendas, it's clear that we're going to need to think about some key considerations. And some of these have come up through the process as well. And we'll need to look at how we can best use observational and big data to help to inform these themes, as well as innovative trial designs. How can we overcome consent barriers? And how can we ensure that key stakeholders are participating all the way through the research process? Also, how can tools such as modeling be used to help to fill some of the data gaps? And how can we make best use of data that's out there and strengthen national M&E and ensure that we have age disaggregated data so that we can really capture these two distinct populations? And we recognize that clearly we all have a role in implementing this, and everybody, I think, is really encouraged to look at this and see how they can, how you can really take this up and work with it. And within the policy briefs, we've provided some suggestions for that, but we'd be very keen to see also in this discussion, hear from you about some of the different ideas that you may have on how you can implement this within your roles as well. But whether researchers or funders, policymakers, implementers, program managers, and civil society and community partners. So finally, I want to acknowledge all of the people who've worked to make this possible, the project team at WHO and CIPHER, as well as WHO staff, the working group who stayed with us throughout the year process, the resource group who joined us for the final step that was added to the GMRI process, and most importantly, all of those of you who participated by responding to the 2 surveys. So with that, I'd like to just remind again that the policy briefs are online, as well as the full list of CHINRI questions. And thank again UNICEF and the collaborative platform for allowing us to present this and working with this on the webinar, and the other speakers. And I'm looking forward to the discussion with all of you. Thank you very much.
Thank you so much, Marissa. Can you all hear me? Hello?
Yes, yes.
Okay, great. So thank you so much, Marissa, for that very comprehensive overview and structure of the prevailing knowledge and research gaps and questions. And I think that structure will provide a very good framework for our discussion later on. And without further ado, I'd like to turn it over to Carlo Oliveras. As mentioned earlier, he is the program coordinator for the Adolescent HIV Treatment Coalition, which is hosted by the IAS, and he's joining us from Puerto Rico, so we're very happy that he was able to connect with us today. And he will be talking about a very important topic, which is how do we meaningfully engage youth and the beneficiaries of research in all the stages of research development, from its conceptualization to implementation. And I think encouraging and enabling youth and beneficiaries to input into research development really only enriches the outcomes and the quality of the research. So without further ado, I'll turn it over to Carlo. And if you're patient enough, I'll load the presentation up as you start speaking.
Thank you, Jessica. Good day, everyone. Thank you for the introduction, and Marissa and Martina and the group for some excellent work through the process. So my task here is just to briefly talk about meaningful engagement of youth. And thinking a bit from research prioritization to clinical trials implementation, science, and policy development. So without further ado, the first stage is how do we define engagement and why is it important? So I want us to take us into the slide literally. So if you know me, I have a fascination for hexagons and beehives. And the way that bees develop their beehives has a lot to teach us about the way we should work as people immersed in society. The topic of engagement, particularly youth engagement in the HIV response, has been called for in many settings, not only in research, but also engagement as civil society, non-governmental organizations, policymaking structures, etc. Yet, though engagement sounds like an easy term, the reality is that it requires understanding the environment in which youth are developing in order to better assess how we are responsibly and meaningfully engaging adolescents and young people. Patient participation and involvement in clinical trials and studies has been shown to improve patients' experience and ensure better quality of the trial study. And the inclusion of children and young people in these trials needs a higher level of support than their adult counterparts. And although this presents particular challenges, there is significant need for effective research to be done with this key group. Currently, there is very limited work in involving young people in the design, implementation, and dissemination of clinical research. And it also highlights the importance of pursuing more research into how we improve patient engagement in pediatric research and the effects of doing so for the overall quality of the research and the patient's experience. So if you go to the next slide, so meaningful engagement in research. The following principles are central to young people's engagement in research to move beyond tokenistic participation towards citizenship. So if we take us back to 1992, Roger Hart, in a UNICEF report titled From Tokenism to Citizenship, presented a series of key principles on how moving beyond tokenistic participation, so very much relevant today, almost 25 years after the report, there's a lot of discussion on engagement yet. There is very little information on how engagement actually happens. So the four principles are quite straightforward. Number one, they understand the intentions of the project, which they're planning to engage in. They know who made the decisions concerning their involvement and why. Number three, they have a meaningful rather than a decorative role in the project, and they volunteer for the project after the project was made clear to them. So taking us back, this was in 1992. More recently, Dr. Sarah Bernays from the University of Sydney and Dr. Magda Conway from Youth Trial Sports Program in the UK and Zimbabwe are working towards creating a youth-friendly training module of community participation of young people living with HIV in clinic and for their peers. In their literature review prior to the implementation of the project, they stress that much of what has been done around engagement of youth refers to improving recruitment and retention, to strengthen the number of participation within the trials, or to ensure that consent is informed. However, how do we engender meaningful engagement in shaping communication between researchers, clinicians, and children, adolescents, and young people? This definitely reflects also on how do we budget for meaningful engagement to happen within our proposals, and how much time do we provide for those who want to engage to actually do so? How are we documenting our engagement practices, and how well do we know the young people we're engaging with? So before moving forward, I think it's pretty, one of the things is to ask ourselves, why are we doing this, and then try and grasp an understanding of what is the community that we're wanting to engage with, and engagements from the get-go since we're starting the proposal development. In the next slide, how well do we know the young people we're engaging in? That is actually the questions that one has to ask oneself when you're starting the process. So meeting youth where they're at and understanding the complexities of being a young person living with HIV is one of the key central areas. One of these complexities of engaging people in research or in any other activity is having an understanding of what it means for the person to be engaged and what is the benefit from their perspective. In the case of youth engagement within the HIV response, there recently has been a greater call to engage youth, yet the resources to support engagement are not necessarily there. A large number of the young people currently involved in the response are doing so on a volunteer basis, and acknowledging this and understanding this from the get-go helps us to really see how do we want to support these young people, how do we want to engage them with, and what type of role do we want them to have in the programs, projects, or research that we're developing. We at the Adolescent HIV Treatment Coalition in June this past year held what we called an intergenerational summit for positive youth leadership. And the summit was structured in a way to understand the ways networks of young people operate, as well as what support they can find in the organizations and groups that are working with them in the HIV response, and finding synergies among the networks. With an assessment tool that was developed by Pediatric AIDS Treatment for Africa, AIDS Funds, and the International HIV/AIDS Alliance, in the Intergenerational Summit, we went through 8 different themes to really understand what are the needs of networks of young people living with HIV, what type of support do they need, and these themes were divided into, well, what are their mission, vision, and governance structures, what financial procedures do they have, if they have leadership transition process, and what type of support is needed in the networks per se. It was amazing to learn that 19 out of the 23 networks that were there, and these 23 networks were a mix of national and regional networks that came from Latin America, the Caribbean, Asia Pacific, Southern Africa, East Africa, West Africa. So we tried to get a grasp of different networks, be national or regional, from across the globe. And out of 19 out of these 23 networks were operated and led entirely by volunteers. And though it's outstanding the level of commitment and passion that these young people have, it presents a challenge for establishing mechanisms for youth participation, as in the end, the day-to-day life requires income, and engaging really impacts the livelihood and development of many young people within the HIV response. The next slide is a quote from one of our participants at the Intergenerational Summit. And it says, "There is a need to talk through social issues, home visits, and personal lives. Young people who are appointed as youth leaders end up bearing the burden of the emotional work that is needed, alongside the financial management that needs to occur. In that process, you find yourself losing your main purpose, your main goal, that you came into this space. The main reason you came into the work is taken away from you as you pour your time and energy into finances and other such things that were not what you were brought into the advocacy space." So this quote from a participant at the summit also highlights the importance of understanding what is expected from young people as they engage, as well as grasping the expectations that they have for themselves as they are engaging. Sometimes you come into a space for supporting your peers, and then you find yourself in a totally different scenario than what you've envisioned. The topic of engagement, as you see, is quite broad, and it would require a lot more time for us to really go into a deep conversation. But the main questions that we should ask ourselves as we move forward with the themes under the research prioritization process is, how do we go beyond the dissemination and to understand the complexities of engaging young people, and how these themes can help us achieve our aim of a better life of children and adolescents living with HIV. So the idea, and I think that the main part of the process is now taking a look at the work that we're doing currently, and not only us at the ATC, but also you and your country and your organization, and seeing what type of procedures and processes you've put in place in order to adequately engage young people. And this starts from, if you have a young person living with HIV in an advisory board, if you're connected to a local network of young people living with HIV or a peer group, listening to what they have to say, what are their needs, and how does that fit into your programs or your research, and having them be included, not only just from the beginning as in an advisory role, but also how the research that we're carrying forward impacts the livelihood of these young people, and how can we support them in their development. So what now? So going beyond the dissemination of the research prioritization process, it is very important that as we have finished this very important process, how do we continue the engagement of young people in order to make sure that the themes are not only understood, but are also carried forward at national and regional levels to demand change? So what now? Connecting research with youth. It is very important that, as I mentioned earlier on, we assess what are the networks, organizations, young people that we are engaging in or we want to engage in, and see how they're organized in their communities. Understanding how does organization look like, and seeing how that research fits them and how they can fit into the research as well. It's important for this to assess the involvement and engagement of young people in order to document the best practice of engagement, and also establishing standards of practice for projects and programs impacting the lives of young people living with HIV. And I think as we move forward and to understand a bit of the standards of practice, as we are seeing new research coming in on the importance of engagement and how engagement has been done in different projects, how do these help us in creating what is the baseline for us to be called and have a good engagement practice for young people living with HIV within our projects? And how do we structure this in a way that it help us move forward? So I want to thank the Youth Trials Board team, Dr. Sarah Bernays and Dr. Magda Conway, Professor Lucy Kluver, and also the Adolescent HIV Treatment Coalition and all the other participants at the Intergenerational Summit for Positive Youth Leadership. Thank you very much.
Thank you, Carlo, for your presentation on engagement of youth. And for the sake of time, we'll move quickly forward to the panel discussion on the role of implementation science in pediatric and adolescent HIV. We will be joined by Anjuli Wagner, who is at the Department of Global Health at the University of Washington, where she currently works as a postdoctoral fellow on projects in Kenya, and she will be leading the panel discussion. And I'm loading her presentation right now. So over to you, Anjuli.
Great. Thank you so much. And thank you to the organizers for the opportunity to be part of this. I'm taking over on the presentation. Let me just make sure this is working. Great. So as everyone has already mentioned, I'm a postdoc at the University of Washington, and my background is as an epidemiologist. And I've been working on pediatric HIV research in Kenya for years, and I had a neat opportunity to sit at the Ministry of Health in Kenya in the pediatric HIV research branch last year. And today I'll be sharing a couple of thoughts from one of the studies that we conducted a few years back called CATCH, which tested index case testing for children in Kenya and was eventually scaled nationally. So my thoughts today are about why I think it's important to engage with ministries of health, and also some practical ideas about how we might engage. And this is from the perspective of an implementation science researcher. So as IAS researchers, we want to test interventions that could be scaled if they're found to be effective. And this means testing an intervention that's in line with Ministry of Health priorities and policies, as well as delivered at the appropriate staff and at the right level in the healthcare system. So, for example, if we design and test an intervention using study nurses, but that type of role is usually performed by community health workers, our study has less of a chance of eventually being scaled and having larger impact. It's also important to have appropriate scientific inference, and as implementation scientists, we often don't have the luxury of running studies with these ideal parallel control groups. And with pre-post studies, interrupted time series, or quasi-experimental designs, we run the risk of attributing a change to our intervention when it's due to some other change occurring in the background. And ministries of health at different levels can be really helpful in understanding what else is happening or planned in the background, and that makes our scientific inference more valid. And then finally, I think it's really important to build momentum and enthusiasm for interventions so that if they're effective, they can be scaled up. So how do we think about actually doing this practically? And I am definitely not an expert here, but here are some strategies that we tried during the CATCH study. So we engaged with a wide range of Ministry of Health employees across the whole life cycle of the project. So during the planning and grant writing phase of the study, we talked with national and county Ministry of Health members. And we also prioritized giving regular updates on progress and disseminating study results pre-publication to frontline healthcare workers and policymakers. So these were little informal presentations at clinic levels, nothing expensive, nothing fancy, but this was a really positive, this had a great positive response, particularly from the frontline healthcare workers during the dissemination. And many of these clinics actually took up the intervention and continued doing it even after the study funding had ended because they felt so invested in the study and had seen the results immediately after recruitment had stopped at their site. And then finally, we need to think critically about how to build these mutually beneficial partnerships. And they're not simple. They require long-term time and financial commitment. And so I've been thinking about how we might replicate this. And there's one model that I like at the University of Washington where there's been a training program for many years that trains Kenyan scientists and Ministry of Health members in advanced degree programs on how to design, interpret, and conduct research. And this program was initially heavily focused on clinical research, but now also focuses on implementation science. And this has had a really positive impact on having a really strong scientific community within research and Ministry of Health in Kenya, especially around the area of peds and adolescent HIV research. But just as we're working to build capacity for Ministry of Health to understand implementation science, we need to, as scientists, we need to build capacity in ourselves for understanding Ministry of Health. And this is a little bit more rare, I think. So I really appreciated the opportunity last year as a scientist to sit within Ministry of Health. And I think that these types of attachments should be further explored and invested in to get this type of understanding. So I'm really looking forward to the discussion that we'll have next. And thanks for this opportunity to talk with you all.
Thank you, Anjali, for sharing your thoughts and ideas. And I know that Shafika Saji from UNICEF has joined us as well. And I'll ask if you have any additional thoughts or comments you'd like to share about the role of implementation science in pediatric and adolescent HIV research. Shafiq, are you with us? Okay, maybe he'll join in a few moments. So with that, we'll open it up for discussion. And like Marissa and Martina had said in the beginning of the webinar, we wanted to hear from all of you about what are some of your experiences and what are some specific considerations that you're facing in regards to some of the themes that were mentioned and the ideas that were mentioned and research priorities that were discussed. And what are the specific challenges you're facing in your roles with respect to implementing the research agendas, and how can the global community help support in addressing these challenges? So these are just some questions to spark your thinking and spark the discussion, and I'll ask Marissa and Martina to please chime in and help to lead the discussion. So we open it up to all of you in case you have any questions. Marissa and Martina, are you with us?
Yes,
Okay,
Jessica,
yeah,
this is Martina. I just wanted to emphasize what we said earlier. We're really hoping that this discussion today helped us to think about what we as international organization can do to help those of you that would like to engage more in implementation science. And so we're very eager to hear what your challenges are, whether you feel like there's anything that we can do to help you doing so. And so any feedback, both on the agenda and any consideration around how you may want to implement this, would be really, really helpful. And we know that on the line there's a lot of people that have contributed to implementation research before, so a lot of you have a direct insight on these issues. So please feel free to share any thoughts you might have and comment based on your own individual experience.
Yeah, and this is Marissa. Just to chime in on that, I think it would be interesting to have any pointers from people who are doing implementation research, especially in pediatrics, but also in adolescents, and some of the main challenges that you might have come up against, and then how you have overcome those. Maybe sharing some of that would be interesting for the other people on the call. And then for those who are trying or thinking about doing some of these things, what are challenges that you might still be facing? And as Martina said, what are potential ways in which the global community can support with that?
Okay, great. Some questions are coming in. So as a researcher on the ground, what is the best way to initiate a collaboration with the Ministry of Health in settings like Kenya? So maybe that, Andrew Lee, that was an idea that you mentioned. So maybe if you want to address that.
Yeah, setting up those initial collaborations is challenging. And, honestly, I think that a lot of it comes down to starting to build personal relationships. And I think that, in Kenya, the HIV branch of the Ministry of Health, NASCOP, there's also NAC. They are quite approachable, but I think that getting an introduction from a relatively senior level, either researcher or policymaker, starting with a connection can help. And then starting with a relationship building meeting where you just kind of inform Ministry of Health on what you're working on, what you're thinking about, and then just listening to whatever kind of input they have, and then starting to build that relationship over time. I found that meetings for updates are really helpful. as opposed to meetings for asks. Also, there are technical working groups within Kenya, and I'm sure in many other countries, that do have sometimes open membership, particularly for technical advisors or other interested researchers. So attending technical working groups is a great way to have some face time with Ministry of Health members and to be seen perhaps as a valuable technical ally that way. But I think it comes down to starting to build those relationships, possibly through a personal connection, having meetings that are not just for asks, but for updates, and then making yourself useful as a technical assistant.
Okay, great. And would anyone else on the panel like to add anything?
Hi everyone, this is Shafiq. I apologize for joining quite late, and I had some slides, but Anjali did such a brilliant job of talking about the implementation research issues that I didn't think it was useful. You know, WHO led the INSPIRE project, and I'm currently at UNICEF, but I was involved with that INSPIRE project for many years while at WHO, and it was focused on a topic which isn't part of the research prioritization exercise, because it was looking at retention in care for PMTCT, but I think what it taught us, which was really valuable, was that implementation research puts governments in the driving seat of the data and the evidence that's generated to inform guidelines. And so it's not only does it produce findings and identify solutions that are de facto implementable because they are constructed within the context of the service delivery program and the apparatus that ministries have to actually deliver the service, but it also is owned by them and therefore much more likely to get picked up at the national level. And we really saw that with the work that we did as part of INSPIRE. So I think it's really it's sort of the critical step to turning recommendations into policies and trying to define more clearly the how-to of the normative guidance.
Great, thank you, Shafiq, for adding that perspective. And there's also another question that came in regards to implementation science. Are there particular implementation science frameworks that you prefer to use in resource-limited settings? Or kind of what adjustments would you might make as you're embarking on implementation science research? So would anyone from the panel like to respond to that question?
Well, maybe I can take a stab. I think it's really about planning with the ministry from the get-go. Anjali has certainly talked about this, and I think that often takes a lot more time than when you do standard research, because you need to actually build the capacity a little bit of colleagues in the ministry to say, look, these are the things that we need to think about. These are the approaches that make sense. You're not necessarily working with folks that have had a ton of experience in research methodologies and in how to track and monitor the development of research. So I would say the lead time is definitely longer. But if you invest in that and you invest that time in building the capacity of ministry colleagues, so that the questions that you're asking are questions that actually they're involved with formulating, I think the outcome, you know, you get the payback for that at the end of the process when you have findings that are really owned and taken up by colleagues from the ministry.
Great, thank you. And Anjali, anything you'd like to add?
I think that Dr. Assaji has said it very clearly. I think maybe a clarification on the question. Was the question also maybe about research frameworks, IAS research frameworks that are used?
Yes.
Okay.
Yes.
Yeah, that one I think is a really interesting question as well, because a lot of the dissemination and implementation research frameworks that are out there have been developed in a high resource context, or in just a different context from where I work in Kenya and where many others may work in resource limited settings. So we've found that some frameworks, and especially measurement tools, really need to be adapted to reflect local dynamics. So we use the Consolidated Framework for Implementation Research, or the CIPHER, which is, I'm happy to share those tools with folks. But for example, there are concepts there around ownership that healthcare workers have, or agency that they have for creating change within their system, and that may look different in Kenya than it does in a US setting, and people may be willing to respond to questions about agency and interactions with superiors in a very different way. So a lot of folks are working right now in the space of implementation research, and especially organizational change, to adapt these tools to be relevant to different settings.
Okay. Great. And we have a comment from Dr. Tracy Evans-Gilbert, who is joining us from Jamaica, I believe. And she's working on reaching the 90-90 targets for adolescents and youth in her local area. Is there a blueprint to get her started? She's currently working with perinatally infected adolescents and would like to branch out to the behavioral acquired cohort and increase the age band to 24. So any recommendations for Dr. Tracy as she thinks about this? And perhaps maybe, I don't know, Carlo, if you want to respond, or any of our other presenters.
So I think this is Carlo. One of the things that can be done is finding the literature on the Youth Trials Board and the work that they're doing, which also supported a lot of what I just presented now. What I can do is channel the questions through the team at the youth to the Youth Trials Board team, and they can definitely help out with what they've been doing, and how can this be adapted or applied into the work that is being led in Jamaica.
Okay, good. Great. Thank you, Carlo, for that offer of support. And we can work definitely offline to connect you and Dr. Tracy Gilbert. So hopefully, Tracy, that we'll be able to follow up your question with more concrete support. So anyone else have any questions, or any of our presenters would like to share?
Jessica, this is Martina. I had a comment and more of a reflection also regarding the funding element of this type of research. I think that, pediatric and adolescent research has been historically funded by some key donors that have that as part of their interest, and I think that hopefully that will continue. But I sometimes ask myself, are people that are actually on the ground, that are thinking about and that are in the position to do this great piece of research that would be so important for normative work, actually aware of the funding opportunities that are available, and are they actually trying submissions for key research questions and projects they might want to undertake? Because I sometimes think that sometimes we don't. It's also about being informed about what's out there, what's possible, and it's not always easy to be on top of all the opportunities and know everything about it. So, if that was a barrier, if being aware of funding opportunities was a barrier, and that would promote more implementation science to be undertaken, I wonder whether we, as international stakeholder, could maybe join forces to try to map what the opportunities are and potentially support and help dissemination of those opportunities in a more systematic way, so that people could really have more access to it and be more aware of it. But this is just a thought, and maybe I don't know if people disagree or agree with that, or have anything else to add on that.
Hi, this is Marissa. I can chime in on that, Martina, and thank you for reminding me. So, one of the first actions for CIPHER as a funder, and as also one of the leads on this project, was to implement the research agendas within our main funding program, which is the CIPHER grant program, which is the grant program for early stage investigators in resource limited settings that we have through CIPHER and the IAS. And the applications for that were open in the month of October, sorry, it's now closed. But one thing that we've noticed from doing that is, and this was a little bit of a shift because within the research priorities we had there, we had a split, pretty even split between clinical and operational research, and it spanned through from infancy through youth. And one thing we've noticed is an increased interest from people from ministries of health, actually, in the program due to that. And I think that really resonates with what both Shafiq and Anjali have been speaking to, that the implementation part of the agenda is something that they feel more ownership in and is closer to their work, and is really that area where we're transforming policy into practice. And so that's one thing that's been interesting to see. And another thing, speaking to what you were mentioning, is that we do have a mapping of other opportunities kind of in the context of setting up this grant program that we do. I think a lot of funders might have this, to set the stage and really identify how you're going to design your funding program. And I think that we might be able to partner with some other key funders and partners in the area to maybe put together a kind of mapping exercise and have that as a resource to share with people. I think that's a great idea.
And if anyone from the audience has any thoughts or feedback about this idea and proposal, please feel free to share them.
Good morning. May I come in?
Yes, of course.
Yes. In fact, thank you very much indeed. This is indeed very interesting forum to discuss very important issues. On the same note, I would like to bring up one or two sensitive subjects which...
Sure. May I ask who's speaking? Can you introduce yourself?
This is Kamil John
Ahmedov.
I am a fast track advisor at UNAIDS office in Uganda.
Okay, great. Thank you.
Thank you. Sorry. In particular, number of countries, especially.
Hello?
Hello.
Hello? I guess we'll wait for
I think it's now it's
back?
unmuted.
Okay, great.
Okay. I would like to bring up one or two sensitive subjects we should be bearing in mind, in particular if we're planning to conduct the studies in concentrated epidemic countries. Unfortunately, in some countries, the adolescents and children got infected because of the nosocomial mode of transmission. And in these countries, due to the sensitivity of this subject, ministries of health might not be always open for the, let's say, research. And at the same time, I would like to bring up this subject about the participation of adolescents and children themselves, bearing in mind the very high level of stigma and discrimination in the concentrated epidemic countries. Because of less number of people, at the same time, people are still considering the disease in a different way, that the participation of adults living with HIV in the process might be also challenging. So we should be bearing these elements also into the account. On the other hand, we simply cannot ignore those countries with such issues around. Thank you very much indeed.
Thank you, Commissioner, for raising those really important points around stigma and discrimination and how that can be a barrier, both in terms of the Ministry of Health engaging in implementation research and as well as engaging adolescents in the research. So do our panelists have any suggestions about ways to overcome that or to deal with that situation, especially in settings where stigma and discrimination are quite high and are the barrier, a significant barrier to conducting implementation research? Marissa or Martina, do you want to take a stab at that one?
Well, I'm not sure I have an answer for that because I don't have a direct experience on that specific setting and can share, a solution to that. But I do think that what you're raising is a really important point, and I do think that we should make an effort in trying to collect experiences of those of you that have done some of this research in these countries and that, share, potential recommendations or advices from them. And again, I think part of this is a lot about creating a forum where we exchange experiences and we exchange, ideas. And, as soon as there is a critical mass of information that we can generate and collect, I think it would be very appropriate for us to, summarize that and make sure that we share that with the relevant partners.
Yeah, I can chime in on this, and maybe Carlo can chime in as well. One thing that we've been discussing within the Adolescent HIV Treatment Coalition is trying to develop some guidelines really on the meaningful engagement of young people in all of the processes related to generating and using information about them in the response, and how to do that in a responsible and sustainable way. Carlos spoke to the challenges faced by youth networks, especially in the context of increasing recognition that we need to have young people engaged in the processes in order to get it right, and that makes an increased demand, which then needs to be met, and for that support needs to be there in different ways, and that would be different in different contexts, and I think especially challenging in contexts of high stigma and discrimination or criminalization of key populations. But it's something that we're thinking towards and working on. Yeah.
Let me chime in and thank you, Marissa, for that. Jumping just quickly in. One thing that we, as part of the work that the ATC and that I've done through the years, we supported the Argentinian network of young people living with HIV, and I'm not sure if this is a direct, the precise response for what you're looking for, but in Argentina's case, for example, it has been very important that the engagement happens with the network or organization that currently is supporting or is supporting young people living with HIV. In Argentina's case, the Argentinian Network of Young People Living with HIV, and what the network has done is that they, in order to connect with other adolescents or other young people that have been born with HIV, how to just go through schools and kind of get into that network of connections between the one-on-one, I would say. So we for example, the Argentinian network has about 800 members, and although the majority are not perinatally infected, they do have a quite large number. And what they do is that they organize around what are their needs within the network, and then how they can reach other young people like them in different settings throughout Argentina. So my strongest recommendation would be to also try and seek that linkage, and if that linkage can't be done directly by the researcher, try and find a community organization or a community lead or advocate that is currently working with young people, and try and assess how is the current context and how those linkages can be made in the setting where the research is taking place in.
This is Anjali. I had another thought on this. I really appreciate hearing this discussion, and I had one thought about what we do in trials and how we would design trials in this way to recognize the heterogeneity in stigma. And I think that, while the long-term goal is completely to eliminate stigma, we have to recognize that that's a long process. And I think that there are ways to design our studies to appreciate that there's heterogeneity here, and there's regional heterogeneity, and there's population-specific heterogeneity, differences in stigma. And so, one example is to design trials that test implementation interventions, actually try them in different regions and appreciate what how stigma impacts the effect of the intervention, so effect modification of these implementation interventions, and then appreciate that some interventions are not going to be appropriate in high stigma settings, but others are going to be more appropriate in high stigma settings. And so that when programming happens at a national or regional level, the results from implementation studies actually can speak to those regional differences, and you can choose an intervention that is most appropriate to the setting.
Okay, great. Thank you all for your valuable insights on this very important topic. And if anyone in the audience is joining us from regions or settings where this is an issue, please feel free to offer your recommendations as well. And we have another question that just came in to either Martina or Shafiq from Stuart Keene. How relevant do you think the ExpandNet WHO resources are to support scaling up the findings of this research? So Martina, do you want to take that one?
Jessica, I just dropped off, so I didn't quite get. Sorry.
A question came in from Stuart Keene about how relevant do you think the ExpandNet WHO resources are to support the scaling up of findings for this research, or to scale up research findings in general? And Stuart, feel free to clarify if.
Yes, could you clarify, please? Yeah. I'm just not sure I got the question right. Is it about scaling up of what?
I think he's asking if the ExpandNet resources published by WHO in 2010 and that site would be valuable in supporting the scale up of research findings. So once research is published, how do we ensure that the evidence-based practices are taken to scale once research is done? I think that's how I'm interpreting his question, but Stuart, feel free to clarify.
Okay, so if that's the question, I think that what typically happens is that we normally really keep an eye on the research that is being conducted, and what we do, we engage on a systematic review of the evidence that normally gets then included into guidelines development processes that then change policies and then are introduced into countries and obviously adapted to the context. So that's sort of a little bit the standard process of that. Obviously, that depends on a lot of other factors, and some research findings sometimes cannot be transferable or translated entirely because some of the intervention may not be entirely feasible or acceptable, and so and in every context. So I think obviously, the sort of translation of research findings into key action at the country level depend on many other considerations. And but that's normally the process that we undertake from the WHO perspective. I don't know, Stuart, if you had something different in mind specifically, or I'm happy to address that if I got it wrong.
Hi, can you hear me?
Yes.
Yeah, no, it's just the back in 2010 there was this big WHO ExpandNet research that was looking up the whole process of how do you scale up promising practices within health systems, and it had taken quite a strong focus on HIV treatment, and so it was based on country studies and then produced this sort of 9 steps for developing a scaling up strategy. And I just wondered, this seems to be very much something that would build on implementation science and could be relevant for this approach. I just wondered whether there was cognizance taken of this work that was obviously done a number of years ago, but which still could be quite relevant to this, taking forward this work on pediatrics and adolescents.
Okay, thank you, Stuart. I think you flagged an important point, and we can certainly work on that and go back to it.
Okay, great. So if any of you have any last questions or comments, please send them in, and I'll also ask our presenters if you'd like to share any last thoughts or insights as a result of the discussion and next steps moving forward. Marissa, do you want to add anything, or?
Yeah, sure. I was just waiting to see if any of the panelists wanted to chime in, but sure. And I'm happy to let people know that as part of dissemination of this, we're looking towards disseminating also more closely with ministries of health, as well as different funders. And I think it's a good idea that came out of this, building a resource of funding opportunities towards this agenda, and that might be something that can help to generate focused funding towards addressing the different themes that are here. And I just want to say that we remain available here to have questions also following the webinar, and different ideas to keep the discussion going. So thank you.
Okay, great. So as we're reaching the top of the hour, I'd just like to wrap up the webinar and thank all of our presenters, Martina Penazzato of WHO, Marissa Riccari of IAS, and Julie Wagner of the University of Washington, Shafika Saji of UNICEF, and Carlo Oliveras of the Adolescent Treatment Coalition. We're very grateful that all of you joined us today and provided such an in-depth overview of the core research priorities for adolescent and pediatric HIV. And I think we have great ideas going forward for how to embark on implementation science, how to overcome some of the challenges to doing so. And I think most of all, we've initiated a dialogue and a small community on how to discuss these issues going forward, and we've exchanged some emails. So again, as Marissa said, please feel free to reach out to us, and we will do our best to link you to the presenters and any resources that you may need in order to conduct implementation research in your settings. So thank you all for joining us today, and we look forward to seeing you on our next webinar. So thank you to all of our presenters, and have a great day, everyone.
Thank you, Jessica. Bye.
Thank you, Jessica. Thank you, and thank you to everyone.
Thanks.